This is just a short presentation with regard to the Beyond International brands of teeth whitening gels. The gels are available for in-chair and also take-home. In this presentation, I'm really going to specifically focus on the in-chair teeth whitening options. Just to give you a quick backstory, I'm a registered dental hygienist. I'm an independent professional. I've had my own teeth whitening and dental hygiene studio since 2014, and over that time I've used a variety of products and eventually come to a selection of products that are my favourite because I get excellent results, minimal to no sensitivity, and the price points are very fair and reasonable, so it means that my margins on my services are very good and make the product purchase worthwhile. So basically for in-office whitening options, the take-home options, I'm going to talk about in-office whitening. As I mentioned earlier, the take-home options are going to be presented separately. So basically, the gels have a chemical activity on the tooth. You can have a chemical activity plus a light activity. And then also the Beyond company have introduced a teeth whitening lamp with ultrasonic technology, which is available and fairly new in the market. So that is something to consider for future. So basically, what are the options for getting whiter teeth for our clients? So basically, you've got the in-office whitening, which is chemically activated. You can use a light, and the more modern teeth whitening lamp from Beyond has ultrasound technology as well. Then you can have a take-home system for your clients, so you can make custom-made trays. You could also opt for the thermoform bite and boil trays option, and you can provide them with a professional whitening gel for take-home. And the legislation in Australia now means that you can recommend stronger peroxide products, but the clinical studies prove and show that the milder 16% carbamide and 10% carbamide gels give the best results over a longer period of time. So basically, time on the tooth is the gel application every day for a period of time is going to give you excellent permanent white results. And the third option is that you can provide a customized option, which means that if you've got a tool bag of products that you can choose from, you might give them an in-chair whitening service with a take-home option. You might get them to use a take-home option and then provide them with an in-chair whitening once they've initiated the whitening process within the tooth structure. So there are lots of different options, and in my training courses I do run through all of those different options from a clinical perspective, a theory perspective, and also from a practical perspective with a hands-on component to ensure that you feel confident and competent with the teeth whitening services that you're offering your customers. So basically we're talking two different products, hydrogen peroxide versus carbamide peroxide. So I guess it's not a matter of who is the winner, it's a matter of in what indications would you use which product. And so having a thorough knowledge and understanding of teeth whitening agents means that you can make informed clinical decisions about what's going to work best for your customers. So at the top level, hydrogen peroxide breaks down onto the tooth surface and provides instant in-chair results. And also, if you were using a hydrogen peroxide for take-home whitening, you would also get instant results. Hydrogen peroxide can cause sensitivity, it can cause dehydration, and you can often get very quick feedback of the results, so that if someone walks out with nice bright white teeth, within 24 hours that could start to fade back, unless you also implement a protocol where you're encouraging your customers to use a take-home system, which is where we recommend a carbamide peroxide gel so that they can continue to put gel on the tooth, so time on the tooth, over at least the next 2 to 3 days for short periods of time, which will enhance and stabilize the in-chair whitening results. Again, I do go into a lot more detail in my training courses, but this is just to really give you an overview of the teeth whitening products and application. The Beyond gels that I'm going to talk about today are the 35% hydrogen peroxide in-chair formula that is only legally allowed for use by registered teeth whitening professionals. So then we have the question of light or no light. Well, clinical studies show that the light has no perceptible difference whether you use a light or don't use a light. The consumer and the customer wants the light because Dr. Google and Instagram influencers tell them that using an LED activation lamp is going to give you excellent results. So who are we to argue with the general population? It's a good idea to have a light because it implies that you're using a professional system. And in addition, there are some photo-initiated gels that do respond better with light activation, and the gentle warmth from the light can have an impact, and the LED blue refractive light on the tooth whitening gel in some clinical studies has been shown to improve the or enhance the whitening results. So there's clinical studies for both pro and against lamps, but the consumer wants the lamp, so my recommendation is that everyone should use a lamp. So basically with the in-office whitening, you'll get a significant colour change in a short period of time. That's what people want. We live in a we want it now society, and quick fix is always the best option. So the Beyond in-chair 35% whitening gel is the go-to product of choice. So the protocol involves controlled use of a high concentration of peroxide. You need to apply a barrier resin to protect the gingiva. The cycles can vary between 3 and 4 cycles of 8 to 10 minutes, and it can be repeated again in a month or 6 months or 12 months. But my personal experience and recommendation is that you would follow that up with a carbamide peroxide system at home, because that really hydrates, stabilizes and enhances the whitening procedure or the whitening service that you've started in the chair. So I treat the in-chair as a jump start, and then I use the carbamide to enhance and stabilize afterwards. So Beyond is a safe product. It's well known for little to no sensitivity. Many people avoid teeth whitening services because they are concerned that they can cause sensitivity, and one of the well-known brands in Australia, professionals using that product recommend that you use a desensitizing toothpaste for 2 weeks prior, and Nurofen products or anti-inflammatory products for 48 hours before the in-chair service, because it can cause extreme sensitivity. And in fact, some dentists actually even go to the extent of numbing all the teeth in the anterior region so they can apply the whitening gel with no discomfort to the patient, and that has other clinical implications. But it just shows you that some products can cause excruciating sensitivity. The Beyond gel has a controlled diffusion rate. It means we've got a shorter processing time, so 8 to 10 minute cycles. The dentine is not affected so that you get zingers in the same way that you might with other products. And the gels also include some desensitizing agents to ensure that there is as much comfort as possible during the procedure. Now, this is a quick snapshot of a video that I made just on the application process. I'm just going to play that for you so you can have a look and see. So basically we use the Beyond retractors with a face cloth. I have a prep liquid that I apply prior to teeth whitening. Just cotton wool rolls on the sides down into the vestibular area. Gingival barrier resin is fabulous. It's got a really nice viscosity and it's easy to manipulate. Cure the resin quickly. Apply the whitening gel, and you would do 3 cycles of 8 to 10 minutes. And as mentioned, you can use it with all varieties of different whitening lamps. Suction the gel off easily, remove the barrier resin, and you can take your after photo and demonstrate to the customer. and minimal to no sensitivity as a result of the in-chair service. And this is the Beyond Max 5 product. So it includes a kit with 5 syringe applications for your customers and all the products that you need to provide the effective service. So this is the kit itself. So you get 5 barrier resins, you get 5 of the hydrogen peroxide 35%, you get 5 of the applicator tips, you get 5 face cloths. So in addition with those whitening kits, you need to buy the Beyond Retraction, which is, I'll show you in a minute, it's an autoclavable blue retractor, and you use that with the protective face cloths. The kit or the gel also is available in a single kit. This is a little bit more expensive, so if people are doing regular whitening services, it's more convenient and cost effective to buy it in the Maximum 5 kit, but it is also available in a solo kit in the event that someone wanted to try it before they decided to go ahead and purchase the bulk kit. It's exactly the same. So if you compare the application system of the Beyond versus a competitor product, Beyond is very simple, and as you saw in the video, all you need to do is pop the blue retractors in, which are autoclavable. You pop the face cloth on, you 2 cotton wool rolls down the sides to soak up any saliva during the procedure, and then it's a really nice application of a very easy to use barrier resin. And compared to the competitor's preparation, where their tagline is all pink tissues must be blocked out, no pink showing. So the preparation time is much more extensive and takes a lot longer than the actual application of the Beyond preparation time. And in addition, their application is 15-minute cycles, where the Beyond Gel is between 8 to 10-minute cycles. So it is a much quicker and more comfortable procedure in that there's minimal to no sensitivity, and the application process is simpler, and the customer is going to be happy and comfortable the way through the process. We get great results with the Beyond. I've been using it now for 7 years. I recommended it to a lot of oral health professional colleagues who are also now using it. More recently, with the release of independent practice regulations, we're seeing more and more oral health professionals going out on their own, dental hygienists, dental therapists and oral health therapists, and they are looking for cost-effective solutions to provide teeth whitening services. And comparatively in the marketplace, the Beyond is very good value for money and the most cost-effective system. So basically the whitening industry has, the cosmetic whitening industry or the cosmetic dental industry has benefited from increased awareness of people requesting aesthetic teeth services. And so we're offering whitening services prior to veneers, prior to implant placement, prior to partial dentures, prior to other services, so that we can prepare the tooth underneath to take on that next level of prosthetic services that they may be, the dentist might be, have recommended for them. In addition, people just want whiter teeth, and we know that because they're buying all the crazy stuff online, they're trying lots of different systems, and they're going to beauty salons who are now offering teeth whitening services. So the salons are only allowed to offer 6% hydrogen peroxide legally. And so when we've got a range of services that we can offer within our professional portfolio, an in-chair 35, we've got a take-home carbamide, we've got take-home hydrogens, we've got a variety of tools that we can combine to provide the best custom designed whitening service for each individual client depending on, their needs. we can grow the whitening business significantly, and it can be a major practice building service that people can offer if they have got a good system, it's well priced, it's easy, and people are walking away with great results and minimal to no sensitivity. The cosmetic dentistry, so this was from the a USA cosmetic dentistry market analysis that was done just to show what they're predicting the market to be like in the future. And so cosmetic whitening is a significant growth area, and in Australia at the moment there are two major players, and they are more expensive than the Beyond system. They've got some differences to the Beyond system. They're very good products. They have great marketing and, support. But, I believe people are starting to look for alternative systems and alternative services at different price points that they can offer their customers so that they can be more competitive in this marketplace of cosmetic and professional teeth whitening. So if you would like more information, you can call me. I have a website where I've got some information there that you could look at. You would need to log in and create an account because I don't sell to the general public. And I also offer professional and product training for oral health professionals, dentists, dental hygienists, oral health therapists and dental therapists. You can have a look at my training platform there below. And if you have any more